The continuum of care in healthcare is an important part of the case management process. Continuum of care is a concept which covers the delivery of healthcare services for patients spanning multiple levels and intensities of care. It is healthcare providers coordinating services for patients moving between care settings, such as inpatient and outpatient, nursing home, acute rehabilitation, and home, and for patients moving between and among healthcare professionals. This continuity ensures consistent, uninterrupted services for patients from one level of care to another, and when done appropriately, it optimizes the patient's health status. The concept of continuum of care is used in case management as it is essentially the backbone of case management process. Case management is defined as a collaborative process to promote quality, cost-effective outcomes. The coordination and collaboration of care by healthcare providers using this concept are essential characteristics for outcome-driven case management. Case management is used for patients with complex problems who require interdisciplinary care and management of services through different settings, which is exactly what the continuum of care is aimed at. In my employment, I work within the Geisinger Health System, which is a large network consisting of 13 hospital campuses, the Geisinger Health Plan Insurance, 2 research centers, and countless affiliated outpatient centers and clinics. I see the concept of continuum of care at work every day within my organization. Medication reconciliations are constantly updated. Care managers and social workers see every patient admitted, even if there is no consult ordered. And all appropriate consults and referrals to help the patient's health are considered and ordered. With Geisinger's large hospital system covering many different specialties, referrals and most of the time appointments for these referrals are made before a patient is discharged from the hospital. This is done so that the patient doesn't have to schedule their own appointments, which, when the patients have to, can lead to appointments and referrals never happening at all. The system scheduling the appointments takes one less thing out of the patient's hands to worry about and works to see that the healthcare providers are doing more things to ensure that the patient continues to receive their needed follow-up care. One program that my organization is using to improve patients' health goals is called Geisinger at Home, and it works just how it sounds. A team that could include a doctor, nurse, pharmacist, and social worker visits the patient in their home to assist with medications, get specialists on with patients for telemedicine visits, and helps line up services for social supports as needed. Team members return to the patient's home for follow-up visits as often as the patient requires, even daily. In addition to this, the patient and caregivers have a phone number to call 24/7 for support, and if needed, get a nurse or other team member out to the home. This community support is to help improve patient health goals and help them achieve a better quality of life, and to avoid unnecessary trips to the emergency room or unexpected hospital stays. Patients enrolled in Geisinger at Home have multiple chronic illnesses. They are only 5 to 10% of the population Geisinger treats, but account for about 50% of the costs in the system. In a 9-month pilot test program, where 75 patients were enrolled, the program was found to reduce costs by 20% for those enrolled, which was $1,000 per member per month. In the first 3 months after full implementation of the program, ER visits for the 400 patients enrolled were down almost 60% and hospital admissions down by 30%. The quality indicator of accessibility can have an astounding effect on quality of care. Patients being able to access preventive and curative health interventions can reduce the incidence of chronic diseases. Accessibility in this case can mean both financial and physical. If a patient cannot afford his or her prescribed medications, he or she won't be taking them. If a patient's insurance has high deductibles and they cannot pay for a necessary service, they will go without and their health will decline. If a patient lives in a rural area and has limited transportation options due to the inability to drive, they may not get to their scheduled appointments. All of these limitations affect the quality of care a patient is able to receive, possibly through no fault of their own. As evidenced by the Geisinger at Home program, having access to healthcare providers and services in the home can improve patient health greatly while reducing emergency visits and hospital stays. Pay for performance rewards doctors and hospitals for providing higher quality care for a lower cost. This has been implemented with good intentions so that patients get the right services for them rather than just the most services that a doctor can prescribe, meaning quality over quantity. The pay-for-performance model encourages best clinical practices and promotes positive health outcomes. This is not perfect, though, because it is impossible to attribute performance outcomes when patients are cared for by multiple providers. In addition, it can cause clinicians to skew their treatment plans towards pay-for-performance practices and away from care optimized for individual patient needs.